Hi, everybody. This is Pete Delatorre. I'm the CEO of Camacol Talk, and welcome to Camacol Talk. Today's program is brought to you by the City of Doral, Baptist Health South Florida, City Place Doral, and Equitable Advisors. On today's program, I'm going to have a conversation with Dr. Gladys Giron. She is a board-certified breast surgeon. Obviously, this is Breast Cancer Awareness Month, so we're going to dive into that topic. Dr. Giron is the chair of the Breast Leadership Program of the Breast Center at the Miami Cancer Institute. So she comes with a lot of credentials and a lot of experience and knowledge. So let's sit back and listen to that conversation. Okay, it's my pleasure to bring to Camacol Talk Dr. Gladys Giron with Baptist Health South Florida. How are you today?
Very good, thank you. Thank you very much for allowing me to take part in this event with you, a very important topic in October, which of course is Breast Cancer Awareness Month. So I'm very grateful for this opportunity.
No, thank you. And thank you for taking time, because I know you have your hands full, very, very busy. It's breast cancer is 365 days of the year. It's not just the month of October, but, we take the time in this month to bring awareness, and it's really worked extremely well getting the word out, and I know it's helped a lot of women get out there, and from your perspective, this any sort of a challenge, health challenge that we can bring awareness to, has that, from your time and your experience, has that made a difference in getting early detection and things like that?
I think there's no question that increased awareness of the disease, of methods of detection, of methods of prevention has made a very big difference in prognosis and survival and the knowledge that is available. We all know that in the old days, those days before us, issues that involved anything that had to do with breast cancer, with ovarian cancer, even not cancer, just issues had to do with women's health were really taboo and not really spoken of. And similarly as well for male issues like prostate cancer. So the fact that we brought so much awareness to the topic has made it such that people feel that they're not hindered to go and seek care, that they're not hindered to talk about and share their experience with others. And therefore, it just becomes a cycle of increased awareness, which leads to earlier detection and of course, better outcomes, because we're able to find the disease before it's symptomatic or at an early.
Yes.
So all of this has definitely been very helpful.
You just mentioned prostate cancer. I'm a survivor of prostate cancer. Just this last summer, I had a surgery, and thank God, knock on wood, I'm cancer free. And so I guess I've now become part of this club, this club that nobody wants to be a member of, by the way. But I hear you loud and clear. So I think a lot of us know what breast cancer is, but can you give us an overview of what it is and who it affects most, and just kind of a short overview on that?
Absolutely. So 1 out of 8 women will be diagnosed with breast cancer. And when we say breast cancer, it's not just one disease. It's a continuum of many different types of cancer. So each individual's case is very unique. We can't just say it's one disease. So oftentimes people will ask, well, why haven't we already gotten rid of cancer? Well, it's a very complex situation. Even within a particular organ, there are many different types of breast cancer. But in a nutshell, really, what is cancer? It's cells that have lost the ability to follow the normal rules of control. Your body will follow what is supposed to be the normal growth patterns, and cancer cells just decide they're not going to do that. And they continue to grow and grow. And that's where we get the formation of tumors that can potentially then break off in breast cancer into your lymphatic system and into your bloodstream and cause metastases or cancer in other parts of the body. For the most part, breast cancer is going to affect women who are postmenopausal. We do see it in younger patients, but the vast majority is going to take place in women who are in their 60s. The greatest risk factor for developing a breast cancer is going to be being a woman and being over the age of 40, really. So that's why we start screening at that age. If you follow the news, newspaper media, printed, social media, there's been a lot of controversy over the past decade or so in terms of what do we do for screening. We all know about the task force that came out and made recommendations that were a little bit different than what we prefer to recommend. So for us in the breast cancer world, as breast cancer doctors, we prefer to continue with the guidelines that over the age of 40, the patient will start having, or at the age of 40 rather, and then they're, as long as they are functional, if you're 95 years old and you're putting on your jeans and your bowling shoes every week, and you're going to do something about a breast cancer diagnosis, we continue to screen you. So every year you get that mammogram. If your breast tissue is dense, the radiologist is going to recommend that we do an ultrasound in certain patients, adding an MRI. All of these things are done to detect. One point that I really want to drive home to everybody is the difference between detection and prevention. So I commonly hear patients come in and they say to me, I don't understand. I get my mammogram every year. Why did I get breast cancer? And it's important to know that the mammogram and the ultrasound and the MRI are not going to prevent your breast cancer. What they're doing is they're helping us find it. So a screening study is something that looks at a patient that doesn't have a symptom, and we may find a disease that's already there, finding it at an earlier stage. And then also when patients come in and have a finding, they have a lump, they have discharge from their nipples, a symptom, and they go and have their studies done. Again, that's for detection, for finding, but not for prevention.
Right.
So that's very important. When it comes to prevention, what can we do? That becomes a little bit hazier, if you will. However, leading a healthy lifestyle, so maintaining an ideal body weight, exercising, which would amount to 150 minutes of exercise a week is the minimal recommendation. And basically just staying healthy are going to be things that are important. And there are other factors in terms of high-risk patients. And that would be something that would be a discussion appropriate with either your primary care physician, your gynecologist, or a breast cancer specialist if, for example, you have a very strong family history and genetic testing.
Absolutely. My mom, was had breast cancer. My two of my aunts on her side. So I kind of lived through that and seen that through the years here. We know, we just heard in the news about a week ago, the First Lady, the state of Florida, has breast cancer, and she's rather young, right? I think in her early 40s. So that it's kind of like it reinforces everything, and it's kind of a sobering piece of news there. Now, breast cancer is typically connected to women, but isn't it true also that men can get breast cancer?
Men can get breast cancer. It's clearly not as common.
Correct.
In women, but we're also seeing kind of harkening back to what we were talking about at the beginning, increased awareness. So the increased awareness in women's breast cancer has also led to an increased awareness in male breast cancer. So although the vast majority of our patients are going to be women, men do come in with the diagnosis. The most common thing that men will have is going to be a lump that they feel. Sometimes there's some tenderness associated with it. Sometimes there's not. They can also notice a change in the appearance of the nipple. So the nipple will become retracted or indented. There can be discharge as well. The most common cause of lumps in males is actually going to be gynecomastia, which is a benign growth of the breast tissue, usually due to medication. But yeah, absolutely. If a man does find that there's a lump, there's something different going on, and it's going to be right behind the nipple, because really the only breast tissue that a male has is going to be right behind the areola and the nipple.
Right.
Absolutely. Go to your doctor and show them what's going on. And then you actually do get mammograms, and we do get ultrasounds the same way we do with women. So we really extrapolate male breast cancer care from what we do for our female patients.
Sure. Absolutely. Now, obviously, we're living in the age of COVID, year and a half, more than a year and a half, living this new world that we've been in there. And we know that COVID has affected the typical screening or procedures that are necessary for other types of diseases that are not COVID. How has the COVID issue affected screening for breast cancer?
So at the very beginning of the pandemic, when we just really didn't know what was going on, how this was going to impact everything, we did have to close some of the centers throughout the nation, throughout the world, in an effort to help to stop spreading the disease and having symptomatic patients come in and infect others as they were coming in for screening. From our standpoint, I'm a breast surgical oncologist and work with the medical oncologists who are the ones who deliver chemotherapy and the radiation doctors. We really didn't hold our breast cancer treatment. So the treatment did continue with caution. Of course, we took every precaution you could think of. But in terms of screening, there was a time when patients were unable to go and have their mammograms, but that luckily was short-lived. And so that doesn't play a role right now. So it's very, very important for patients to understand that there is no reason, unless of course they're symptomatic, there's no reason for them to not go and have their screening studies taken care of. They need to go and get that mammogram done yearly if there's any symptoms that they're feeling, a lump, nipple discharge, skin changes, anything that worries them. Please go see your doctor, go get your studies done. There should be no reason for this. Also at the beginning of the pandemic, because we didn't quite know what to do, we changed the way that we treated our patients. So we were put them on medication instead of taking them to the operating room right away. And we were working on really using national recommendations. We had a lot of Zoom meetings with all of the experts in the world of breast cancer care so that we were kind of all on the same page. Long-term effects are going to take a while for us to see, but it's been business as usual, and it should need to be business as usual. Patients should not be afraid to go and get anything that could be a breast cancer taken care of.
No, I think that COVID is one thing, but there's so many other issues that we need to deal with and take care of, and not put it to the side and dismiss it, because that could be fatal, and we don't want any of that going on. So we're in the age now of the vaccine, the COVID vaccine, and so how is that playing out in terms of anyone that may have breast cancer? I mean, should they go get a vaccine? Should they wait? I mean, what's your answer there?
So clearly, the first thing we're going to say is make sure that you check with your primary care, that you're not part of that high-risk group as per the CDC guidelines. So those would be patients that we would have you discuss that with your primary care physician. But being a breast cancer patient in and of itself does not mean that you should not get the vaccine. Quite the contrary, we want you to be protected. One of the main issues that came about with the COVID-19 vaccine in terms of screening studies is that when you receive a vaccine, clearly your immune system is activated, which means that the lymph nodes that are underneath your arm in your armpit area will become enlarged and inflamed, and that's part of your reaction. That means the vaccine is working, but it also means that if you go and have your mammogram, an ultrasound, an MRI done at that time, that the lymph nodes may look enlarged, and the radiologist may ask you to go ahead and repeat those studies a few months, a few weeks later, depending. So that's just something to keep in mind. If you're having an issue on one side, then go ahead and have the vaccine on the other arm. But don't be afraid to get that vaccine, because you're not going to be at an increased risk of an adverse reaction because of a breast cancer diagnosis. Now, in the middle of treatment, you're receiving chemotherapy, other types of therapies, then it would make sense to speak to your medical oncologist so that you can then find the ideal time to go ahead and have the vaccine. As a surgeon, we also don't want you to have the vaccine a day or two before your surgery or a day or two after, right? We don't want you to not feel well and have a fever and then not know if it's anything that's related to surgery or related.
Right.
We definitely encourage you to follow the correct guidelines, protect yourself and your family, and get that vaccination.
I think that we don't know where we're going to go with what's going on with COVID. I personally think it's going to be just a part of our lives right now, and there's and it's something we just got to deal with. But I think at the end of the day, you've got to take care of all the things that you've done, the cancer screenings, whatever that might be, regardless of your health challenge, something that you cannot discard or put it to the side because of COVID. It's matter of fact, the more vulnerable you become, then the more, the situation with COVID. So we just got to do what we have to do there. Any final thoughts before we wrap it up?
I think the main thing is to not be afraid. to not be afraid. Even before COVID, we had patients who would be afraid to come in. They would know that there's something wrong. They see there's a lump. They know that they've had nipple discharge for quite some time, but they're very scared. They're scared of hearing the word cancer.
Yeah.
It's important to understand that the majority of our patients actually do very well because of the fact that we've made so many strides in early detection. And for those patients who come in with more advanced disease, we have so much available these days, and our experts, our medical oncologists are such well-rounded experts, and we have so many possibilities. We have patients who live with metastatic breast cancer. So don't be afraid. We're really here to help you in any stage of your disease. What we don't want is for you to ignore something and then come in at a point where we could have helped. We can help. Don't be afraid. Come in, spread the word, go get your mammogram, not just in October, whenever it is that you're due. That would be my message.
Yeah, and I think it's a great message because, like I said, I went through prostate cancer, and I know if, as a guy, guys are really bad about going to the doctors, because they might find out something along the way there. That's our mindset. But I will tell you right now that in terms of breast cancer, particularly for women, do what you got to do. Listen to the doctors, listen to the advice, get your screenings done annually. And don't sit there. And if you've got that situation develop where, oh my God, this might be that, let me not go because I might get bad news. No, go, get it done, take care of it. And you never know. I mean, that's really the prudent thing to do. Dr. Giron, thank you so much for taking time to be with us. This is timely information. It's important, and we just got to keep it front and center moving forward. So thank you.
Thank you very much for this opportunity.
All right. Have a great day.
The same to you.
Take care. Bye-bye. A big thank you to Dr. Giron for some great insights for the benefit of the women out there that are, looking at this whole breast cancer situation, and some great tips so that you can take care of yourself. Thank you for being with us here today. Again, this is a program we do Fridays at 11 a.m. on our Facebook page and our YouTube channel. I'd like for you to follow us on Facebook, Twitter, Instagram, LinkedIn, and of course, subscribe to the Camacol Talk YouTube channel. Thank you so much for being with us. You have yourself a fantastic week.